This is the DIY approach to relaxing and releasing your pelvic floor. So why are we beginning by focusing on relax and release? It's to enable you to build up an awareness of any tension that you might subconsciously be holding in your pelvic floor area, and to have the skills to let it go, to allow all the muscle fibres to release, encouraging a better blood supply, to bring oxygen and nutrients to the area. And to give your muscle a chance to strengthen, it needs to begin from its fully lengthened starting point and contract to reach its fully shortened finishing line. So using some physiotherapy muscle relaxation techniques and guided imagery, this video will help you to encourage your pelvic floor to sort of chill out really. We're going to be practicing belly and pelvic floor flops and bottom breathing. So you need to get comfortable in a side lying position. In this position, we are protecting our internal organs so we feel safe. It's a bit like being back in the womb. Gravity is eliminated and our muscles begin to go sort of off guard. It's important that you're comfortable, so you need lots of cushions, pillows. If you lie on your bed or on a sofa, try and keep your neck in a neutral position. So use a small pillow under your head. Tuck one arm under your pillow and have your upper arm supported so it's in line with your body. Put a tummy pillow in place, and one final pillow or cushion support needs to go underneath that bent top leg. Once you're sort of cuddling your pillows, then we're ready to begin. Some top tips: listen to the routine a couple of times so you're aware of the steps. Choose a quiet time, set up your surroundings, perhaps light a scented candle, play some music, whatever you associate with rest and time out. Starting with your upper body, keep your elbows bent, stretch out your fingers and push your lower arm into the bed and slightly lift your upper arm away from its support. Just feel the tension build and travel up from your hands along the outside of your arms, and hold onto that tension for 10 seconds. Then let your arms release and your hands soften. Be aware of that soft, supported sensation from your fingertips right up to the top of your arms, travelling all the way up into your shoulders and neck. Just think about your jaw area. Keep your lips together and then draw the tip of your tongue back along the roof of your mouth. Hold onto that tension for 10 seconds, a gentle, focused pressure. Then let your tongue release and be aware of that sensation of heaviness in your jaw. Moving on to your feet and legs, keeping your knees bent, pull your toes and feet upwards. Feel the tension along the front of your leg and the stretch in your calves. And again, hold for 10 seconds. And then release. Focus on that leaden feeling in your feet. Think about your top leg, keep that knee and hip bent and try and lift your leg off the pillow, but don't actually allow any movement. At the same time, press your underneath leg into the support. Feel the tension build in the muscles around the outside of both of your hips. Hold the tension for 10 seconds. And then release. Be aware of how heavy both of your legs now feel, as if it would be impossible to move them. Keep your breathing steady. Let your thoughts drift towards your belly button. Can you draw it in slightly? Be aware of the tightening feeling. Hold for 10 seconds. And then slowly release. Let the whole of that belly area, from its base above your pubic bone right up to your ribs, rest onto the support. Allow your belly to completely flop. Be aware of what this belly flop sensation feels like. Let your mind focus on your breathing. Think about that area of your belly around your tummy button. Notice a steady rhythm. As you breathe in, your belly button bulges a little more onto the pillow. As you breathe out, it moves back. Be aware now of your undercarriage, saddle area. Focus on your back passage and very gently tighten as if you were trying to make your bumhole wink. Continue that tightening, that tension, and allow it to spread forwards. Imagine you're trying to hold on to a small amount of wind or wee that might escape, just for 10 seconds. Release and let that tension go. Now you're aware of your pelvic floor area. Imagine a warm, melting sensation. It starts at the front and spreads throughout the whole of your undercarriage. Your belly flops as you breathe in. Allow your pelvic floor muscles to join in with this. Breathe in, belly flop, pelvic floor flop, and sigh as you breathe out. Visualize goodness flowing into your pelvic floor. Feel the sensation of melting and warmth spread through the whole of your pelvis, soft, safe. You may want to try the very gentle technique of bottom breathing too. This movement is not a heavy bearing down, it's a gentle, light and controlled. So breathe in, feel the forward belly movement as the air moves in, and then sigh out. And then again as you breathe in, feel the air push into your belly. Allow some pressure to flow down onto your pelvic floor, as if you're pressing down on a bubble, but not wanting to pop it. Try this bottom breathing technique just a couple of times if you feel it increases that sensation of warmth, melting and softness in your pelvic floor. Just rest. Give yourself some time out in this position. Let your thoughts drift away to your happy place for a while. When you're ready to get up, take it very slowly. Perhaps roll onto your back and have a stretch. Once you're used to the technique, it's possible to run through parts of this routine in different positions. Only practice the bottom breathing when you're lying down. So is relaxing and releasing my pelvic floor the same as stretching and lengthening? Well, movements that involve the spine, the hips, the knees, indeed the whole body are going to affect the pelvic floor. And this is because tendons and ligaments, muscles and something called fascia, which is like kind of layers of wrapping paper, they're all in some way connected with the pelvic basin. However, the muscle fibres that make up the pelvic floor, they can't be stretched in the same way as other skeletal muscles because they attach to fairly sort of fixed structures. But the tension and the tightness in muscles around the pelvis will affect the pelvic floor. Before we move on to strengthening techniques for your pelvic floor, let's just have a think about what happens when you work a muscle hard. We've probably all experienced that kind of next day muscle ache, the sort of sensation that you get after you've exercised. Well, that's when a muscle's complaining because it's being pushed beyond its usual comfort zone. And it's a good sign. It means the muscle is rising to the challenge. It's becoming stronger, more responsive, bulkier. So some post-exercise soreness is good, but muscles do need to rest and they need recovery time, and that is really important. So if the exercise routine you've put together causes soreness that lasts a few days, then you are doing too much. So have a few days rest and start at a lower level. The techniques described below are to enable you to get to sort of kind of really connect with your pelvic floor, to increase your brain's awareness of what's happening and to coordinate your breathing. We're going to start by focusing on those deep pelvic floor muscles. So these are the traditional exercises you may be familiar with and perhaps have attempted to do on numerous occasions. Let's see if we can nail the technique this time. Position is important at first, so you need to be sitting upright on a firm surface with your weight going through your sitting bones. Use a small cushion to support the hollow in your back. We're going to start by relaxing and releasing. So remember that feeling of letting your belly and your pelvic floor completely flop. That's the first action to focus on. When you did your pelvic floor self-assessment, how long could you hold on for? Let's use a 5-second hold as an example. Think back to all you've learned about your anatomy. Now you're going to activate your deep pelvic floor muscles, focus on the circle of muscle around your bum hole and start tightening as if you're stopping yourself breaking wind, and then continue with that tightening sensation. Remember, those deep muscles are going to pull upwards and forwards. So think about closing your back passage, then your vagina and your bladder openings, and lift them all upwards and forwards. Can you hold on for 5 seconds? 1, 2, 3, 4, 5, and then release and let go. Think soft belly and soft pelvic floor. Now we're going to coordinate your breathing pattern. Breathe in, allow your belly and pelvic floor to flop. On a slow out breath, imagine you're blowing gently on a hot drink, and as you do this, engage your deep pelvic floor muscles and hold on during your 5-second out breath, and then let go, slowly allowing your belly and pelvic floor to feel soft and released. If you find that 5 seconds is too long to hold, and when you let go, your muscle is already released, then try a shorter hold time and repeat this cycle 5 times. Let's activate the fast twitch fibers to finish off the exercise session. An in breath with your belly and pelvic floor flop. On a slow out breath, you're going to activate your deep pelvic floor muscles as before, but this time don't hold on. So it's a good, firm, fast squeeze, lift, and then release straight away. See if you can do 5 of these faster squeezes on that out breath. Then relax and release. Think floppy belly, soft pelvic floor. You're aiming to do your pelvic floor workout 3 times a day. Build up steadily and slowly, waiting to see how your muscle feels after its workout. It's okay if you feel some tightening in your lower tummy muscle when you engage your pelvic floor muscles. So what about progressing? Well, many women find that by building their workout up every week, just by adding 1 extra second hold and 1 extra contraction and doing that at each session can work really well. So eventually your 3 times a day workout consists of holding onto a 10-second contraction with a 5-second rest 10 times, followed by 10 of the faster squeeze, lift, release with no hold, around a rate of about 1 contraction per second. Just remember, there may be times when the exercises feel harder, when your muscles are tired, and times of the month when those fluctuating hormones can affect your pelvic floor tissues. Now we need to focus on the superficial sex pelvic floor muscles. The 2 muscles we're looking at activating in particular are the ones that attach to the area around the clitoral hood. And we're going to be using physiotherapy techniques of pressure and stretch. Let's call them FitClit techniques. The soft tissues of the labia and the fatty tissue covering the pubic bone are movable and loosely bound down, and we can use this fact to our advantage. Soft pressure combined with a gentle glide of these tissues can increase our awareness and encourage the muscle fibres to contract. You could try this technique in lying on your side or lying on your back. So find your belly button and follow straight down to land on the central front section of your pubic bone, and then walk down onto the lower edge of the bony pubic arch. As you move over the edge of this arch, you land on the area just above the clitoral hood. Place the tip of your index and second finger firmly over each side of the clitoral hood and apply gentle pressure directly onto the pubic bone using both fingers. Keep the pressure in place and glide the tissues under your fingers upwards and forwards. It's a small movement, around a centimetre, but the tissue is surprisingly movable, and this glide puts a small stretch on the muscle attachment. Once it's stretched, it's primed to contract. So release the glide very slightly and do a pelvic floor muscle contraction, focusing on trying to stop yourself having a wee. You should feel the area under your fingers pull down towards your vagina. Visualise the movement as a blink or pulling down a blind. Hold on to that contraction for 5 seconds and then release your muscle and completely release the pressure and glide for 10 seconds. Gradually build up the program to a 6-second hold 6 times, 7-second hold 7 times, until you can manage a 10-second hold 10 times. And this needs to be done slowly over a period of a few weeks to avoid any muscle soreness. The deep pelvic floor muscles will be joining in because these undercarriage muscles work together. However, the FitClit technique really focuses the attempt at activity on the superficial sex muscles. A couple of top tips. Perhaps just mix things up a little bit. Sometimes focus on the deep pelvic floor muscles for a few days, especially if your main problem is leakage, and then swap to focusing more on the FitClit exercises. The resource page has details of the FitClit exercises and how to do them in a sitting position. So how do you progress your pelvic floor exercise routine? Here are a few strategies that can be used to give your pelvic floor muscles a more intense workout. It's top training, controlled release, changing your position and adding movements. So top training, that involves tightening your pelvic floor muscles firmly so that they're in a fully shortened position, 100% squeeze. Then release this squeeze slightly to 80% and then take the squeeze back up again to 100% before releasing to 80 again. Repeat this tugging movement 5 times and then fully release and let go. Don't forget your time out, the 5-second belly and pelvic floor flop. With the progression controlled release, you're going to take your muscles up to the 100% squeeze, release to 80% and maintain it for 5 seconds, release to 50% and maintain it for 5 seconds and release to 20%. 5-second hold and then finish with that belly and pelvic floor flop. Let's look at moving to a standing position. The DIY approach suggests an adapted standing position. This helps to make breathing control a little easier because the upper chest area is fixed. So get into a forward lean standing position against a wall. Feet hip width apart, forehead in your hands, elbows supported, shoulders relaxed. Allow your belly to flop and your pelvic floor muscles to release, and then focus on those gentle belly breaths. On an out breath, think about activating your pelvic floor muscles. Allow the lower tummy muscles, the ones that lie across the base of your tummy, to join in. And see if you can do a basic pelvic floor workout in standing, perhaps starting with a 5-second hold, repeated 5 times, followed by those 5 faster squeezes. Belly and pelvic floor flops always to finish, and then progress this routine in this adapted standing position to your 10-second hold 10 times, followed by 10 fast contractions over a period of weeks. If you want to progress further, practice your workout in a fully upright standing position, and then perhaps standing with your feet slightly further apart, a stride standing position. The final stage of progression is to add movements, which is outside of what we can comfortably cover in detail in this video. However, the increased strength in your pelvic floor muscle should now enable it to be a more active member of your core team. So think about starting with lower impact exercise. Find an activity that you really enjoy and see the resource page for more information about this subject. Can I only do pelvic floor exercises when I'm breathing out? It may seem a little bit strange that this has been the guidance so far, because this rule just doesn't seem to apply to any other muscles in the body. And it's because your pelvic floor muscles are wired to work on your breathing. So if you think about it, coughing, sneezing, they're out breaths. As your breathing muscle, the diaphragm, relaxes, it moves air out of the lungs. And the effect of this is to encourage your pelvic floor to draw in. However, it's also important to be able to actively engage your pelvic floor muscles, whether you're breathing in or whether you're breathing out. In sitting, with gentle, steady breathing, do your belly and pelvic floor flop, and then draw your pelvic floor to around 40% of a maximum squeeze and keep it in that position for about a minute. Your lower tummy muscles may want to join in a little, and that's fine. Keep any tension in your tummy at a low level and then finish with a belly flop and drop. Progress this by trying the technique in a standing position and then try to do it when walking, perhaps from one lamppost to the next. Can you increase that hold time to 3 sets of 1 minute? Don't forget the belly floor flop too. Giving your pelvic floor rest and time out is really important. So well done, you've completed the whole DIY program. Just a few final points as we draw to a close. Does this sound familiar? I always start off well with good intentions for a couple of weeks and then forget to do my exercises. Well, welcome to the club. We're all the same when it comes to making changes to our habits. It can help to make a plan, and if you stick to it, give yourself a treat. One of the top tips is to tie your exercise routine into your daily morning and evening bathroom routines. Remind yourself by putting your toothbrush or your makeup bag somewhere different, and then always treat yourself when you stay on track. Apps are great reminders, and DIY recommends the highly acclaimed Squeezy app. Check out details on the resource page. Have you ever felt like this? I've missed a few days and I feel as if I'm back at square one. Well, the road to recovery can be bumpy, so don't overanalyse. Accept a few ups and downs in the short term. Try and look back over a few weeks or months to see if there's a general improvement in your symptoms. Am I really going to have to do these exercises 3 times a day for the rest of my life? Perhaps a more helpful way of thinking about it is there needs to be a kind of a maintenance and upkeep strategy in place, and this is very individual. Some people find this routine works well. Just 1 set of pelvic floor exercises each day with a 10-second hold 10 times, but including in that the top training that we looked at earlier, followed by those fast contractions. Congratulations, you've finished the DIY program. There has been a lot of information to absorb. You may want to go back over certain sections that you felt were more relevant to your symptoms. If you've taken on board some lifestyle changes and if you're sticking to the pelvic floor plan you've put in place, it can take around 3 months before you'll see an improvement. Now, some women who've tried to focus on self-help do reach a point where they don't feel their symptoms are significantly improving. I just want to reassure you that all the work that you've done so far will not have been wasted, but now is the time to seek further advice from your doctor or healthcare professional. You might find our signposting page helpful. I hope you feel empowered and can move on with more confidence in your pelvic health.